Medical professionals of Reddit, have you ever had a patient so lacking in common sense you wondered how they made it this far? If so, what is your story? There is a reason the instructions for prescription suppositories say unwrap and insert and not just insert. I'm a pharmacist. One evening shift I was working a relief shift, not my usual pharmacy. A man comes in looking distressed. Man, I had sexual relations with a woman I do not intend to pursue a long-term relationship with. Yes. He said it just like that. Me, okay. I'm assuming there was an accident or it was unprotected. How long ago did it happen? Man, last night, at 7 p.m. on the couch. Whoa TMI, I just need to know approximate time to know if Plan B will work. Oh. Me, we have this medication called Plan B, and since the incident happened within 72 hours. Man, oh yes, I got that for her already yesterday right after we finished. We want to know if there is anything we can do to know if she is pregnant now. Me, unfortunately not. She'll have to wait 3 weeks or so to see if she gets her period, and if she doesn't then she can do a pregnancy test then. Theoretically you could do a blood test for faster results, but that would also not be until a couple of weeks, at least. Man, we're just really anxious because she really doesn't want to be pregnant. Is there anything that she can take to prevent the pregnancy? Any multivitamin? Minerals? Food? Me, she's already taken it, which was the Plan B. There are some other options but those are prescriptions. And no, there are no over-the-counter products she can take. Man, what about me? Is there anything I can take now to prevent the pregnancy? Any multivitamins or minerals? Me no sir. There isn't anything you can take now. 73 here, former clinical microbiologist, long ago. Still, I found myself all over the clinical lab at times, not just infectious disease. So, one day, this 20-something guy, wife and mom in tow, walks in with a paper request for semen analysis, pre-computer era. Okay, not the most comfortable encounter, but I'm a professional and did this drill many times. He had not been briefed by the doc and had no idea how establishing infertility in males was done. Well, okay, a challenge, then. I took him aside and using standard medical terminology told him how a diagnosis is made and what he needed to do to provide a specimen. He wouldn't believe that I was asking him to masturbate into that container. Astonished. Then he played dumb, as if the word was unfamiliar to him. We looped through the medical terms and procedure again, and I eventually resorted to every word I knew to describe the act. It was like a George Carlin bit. A half hour later, he emerged from the toilet with 2 inches of urine in the cup. God almighty! The report went back. Patient provided improper specimen. Paramedic. Elderly woman complains that her mouth is dry and she felt a bit dizzy climbing the stairs earlier. Go through the whole rigmarole of getting a medical history, vitals, more detail on symptoms. Ask her what she's had to drink today. A cup of tea, 10 hours ago. Any water? No. Guess what fixed it within 5 minutes? Physical therapist, had a patient with neck pain and spasms, also complained of anxiety and heart palpitations. Asked about caffeine intake and patient revealed drinking an average on 15 to 20 cups of coffee daily. Had a buddy who was an EMT, he was called out to a location for a gunshot wound. Apparently what happened is a father was mowing his lawn when he accidentally touched part of the mower near the engine and burned his hand. He got mad at the lawnmower, pulled out his pistol, and shot it. The bullet ricocheted and hit his son in the leg. Not me but my mother would pick up shifts as a nurse sometimes in labor and delivery and she had met a handful of women who didn't know the baby was going to be coming out of their vaginas. Like no clue. My mom usually said something like how you got it in is how it's coming out honey. This was the late 90s early 2000s. Rural ER doc here, 35-year-old female walks in with right-sided jaw/neck swelling. I think it happened because I ate some meat yesterday that my body is reacting to 10 minutes later, oh yeah, and I accidentally swallowed a bee and it stung me in my mouth right before this happened. Sorry I forgot to mention that. Not me but my wife who is a vet, had a client who got mad at her because he didn't realize that once he neutered his dog that he wouldn't be able to breed it. Had an 18 or 19-year-old girl come in my ER with some complaint that required an X-ray. It's standard that we do a urine pregnancy test prior to imaging on any female of childbearing years. She insisted she'd never had sex and there was zero possibility of pregnancy. We did the test anyway and it resulted that she was pregnant. We did a blood pregnancy test to confirm the result, since she insisted she couldn't possibly be pregnant because she'd never had sex. That was positive too. We gave her a few minutes to herself to figure out what the hell happened, and when I returned to check on her a short time later she asked me if she could get pregnant even though her boyfriend didn't go all the way in. She 100% believed that long as his penis wasn't entirely in her it didn't count as sex. It took nearly a half hour of explaining reproduction to her for her to understand that whether it's halfway in or all the way in sperm travel. Had an adult male patient who needed a Foley catheter. His mother was in the room, and they both lived together in the backwoods of TN. I informed them both of the order for a catheter, how it works, and why it was needed. His mother stated, well, he's still a virgin and I'm not sure I'm comfortable with his virginity being taken in a hospital. Not a personal experience, but one from a colleague of mine, I only saw the pics. So this 60-something-year-old suffers from an acute complication and gets a pacemaker to solve the problem. Everything goes normally and as planned, he recovers, every care and meds that he needs to take are prescribed, explained, and medical appointments with a cardiologist/arrhythmologist are scheduled so that he may get the follow-up he needs. The man then proceeds to never show up to any appointment and never answer any calls from the hospital to know of him and reschedule. This went on for around 3 years. Until he shows up without former warning and asks to talk with the doctor that did the procedure to put his pacemaker. People are weirded out, but seeing that on that day the doctor was present and this patient was in clear distress, they talk to him and manage a couple of minutes to have the doctor check on him. Inside the appointment room, the doctor takes notice that this man is wearing a bra inside his shirt. The man explains he has been wearing his daughter's bra for 3 months after his problem got worse. The shirt is asked to be taken off and there he stands, the shirtless man wearing his daughter's bra, showing off the pacemaker, that should have been kept inside his body, dangling outside of it, being held by the left bra cup, with a big infected open wound above it with the pacemaker lead still inserted onto his veins and connected to his heart. Nobody has any idea how the man let that situation come to be or how he didn't die of sepsis or any other health problem that may appear for that matter. TLDR, man gets a pacemaker. Doesn't show up to appointments. 3 years later comes to the hospital looking for help, wearing his daughter's bra for 3 months, to serve as a holder for the pacemaker that got out of his body from his infected open wound. Working midnight in the ER. Family brings in a 4-year-old at 2 am-ish. I ask them what is wrong. Them, ask him, the 4-year-old. He said he needed to see a doctor. Me, did he say anything was wrong? Them, no. He said he needed to see a doctor, so brought him. A quick back and forth that firmly establishes that they actually showed up in the ER at 2 am, purely because the 4-year-old said he needed to see a doctor and they don't know why. Me to child, why do you need to see a doctor? Kid, the doctor has suckers. Me. To be clear, it is the parents who lack sense and not the kid. Saw a chart once where a person came in for a burn to their eye. They told the drive they read online that warm milk in the eye can help with irritation and their eyes were irritated. So they boiled milk and then poured it in their eye. Burned it all. I am a dermatologist in India. As is the culture here, people eat with their hands, and almost all of our curries or even other dry side dishes have a lot of turmeric. It is common knowledge to anyone born and brought up in India, that this means the nails of your dominant hand, statistically the right hand, are going to be yellow stained, because we have seen this happen since our childhood. Usually this wears off in about a day and a half if you wash it a couple of times. Cut to the first patient in my OPD, a young girl in her early 20s, very anxious. Me, what brings you here today? P, doc, my right hand fingernails keep getting yellow discolored. Me, only right hand. P, yes. And only after meals. Me, do you eat with your hands? P, yes, always. Me, so, you know it's just turmeric, right? P, yes, but can you make it stop happening? Me, for God's sake, use a spoon. P, so you mean there is no medicine to make it stop? Me. P. Me, no. This might hit home more with people of South Asian cultures or people who habitually eat turmeric cooked food with their hands. Anyway, for a grown-ass person to complain of this was just well surprising and a little ridiculous. What's a dead giveaway that someone is a piece of shit? They only talk about themselves and complain about every little thing. They also expect you to help them, but they don't give a damn when you're in need. Oh yeah, and never apologizing or being accountable for anything. When they say fuck all my haters when people are just giving them suggestions on how to be a decent human being. When you're having an argument with someone and they start saying things just to hurt you because they don't have a valid argument. Yeah, this one's personal. When the rules apply to everyone except them. They talk about cheating on their partner in a bragging way like it's something that makes them cooler. When they mock you for trying to lose weight or trying to improve yourself in general. They can't handle being wrong. Saying horrible things about people all the time. Bro, look at this. Shows a minor achievement I'm proud of. Oh bro, that's so easy, I literally did that like a million times. With all due disrespect, fuck yourself. They litter. When they constantly try to one-up you in a conversation. They don't respect the people who clean up their shit. A coworker once made fun of National Custodian Day. How they treat their significant other in front of other people. If they don't care about anyone or anything but themselves, then that's usually a pretty good indicator. For me it has to be when they treat animals really poorly. What success story is widely thought of as rags to riches, but in reality they were wealthy individuals all along. Didn't Kylie Jenner get an award for youngest self-made billionaire or something ridiculous when we all know she didn't do that herself? Drake, who grew up in a ghetto, in Canada, yet could afford to play hockey as a kid, was on TV at 15 because of connections, and his first concert was as the opening for Ice Cube. Definitely didn't start from the bottom. Aubrey Drake Graham. Started from the bottom, now we're here. Bullshit bitch, you grew up in Forest Hill, one of the wealthiest neighborhoods in Toronto. Ed Sheeran. There was even a false story he was homeless in his early career, no doubt pushed by his record label. Reality, he went to private school and has rich parents. For some time Kylie Jenner was applauded for being the youngest self-made billionaire even though she was born into a multimillionaire family. Guy I used to work with was one of those types who always bragged how he saved and you could do the same as me and stop whining about being poor. He always skipped that part about his dad being a very successful businessman who gave him a job, and a free house as soon as he was an adult. Now, on the flip side, I worked with an 18-year-old kid who asked if he could borrow one of my servers to host a little website he was playing with. He was a good worker, always asking good questions and learned fast. Sure kid, knock yourself out. He worked really hard on it too. 5 years later that site was one of the biggest on the internet and he's worth millions. Last time I googled him he was retired and spending most of his life traveling around. I won't dox him by saying his name, but it's a review site. Jeff Bezos was a hedge fund manager and VP at a banking firm before he founded Amazon. His grandparents were well-to-do energy politicians. Bill Gates starting Microsoft in his garage. His mother was the child of a banker who was the child of a Federal Reserve chairman. She was also on the board of IBM, University of Washington, a major bank, and United Way. His father was a lawyer. Kid Rock. Bill Gates. His dad was a corporate attorney and probably was the one to tell him, listen, don't sell this DOS thing to IBM, see if they'll license it. Every young person that the news always puts articles out about who are like, this is how I managed to buy a home at 22. They're rich. That's always the answer. They work a 9 to 5 and they save $50 a week, their parents left them $100,000 and they don't order takeaways. If we can do it, so can you. Edit. I'm loving reading the stories of how some of you were able to actually pull this off on your own. It's nice to see there are success stories. Kid Rock grew up on an estate, not in a trailer. Cinderella. She never lost her wealth technically. She was already a high-class lady and was never poor. On the inverse, Cristiano Ronaldo is true rags to riches, I believe. Billie Eilish. People think she did it herself as a young teen, but her family has been in the industry for years.